Hello, creators. Registration for our next Wellness Center Creators Retreat opens September 1st, 2025. And we'd love to have you join us in person in Vancouver, Washington, September 22nd through 25th in 2026.
We've only got 20 spaces per track, so be sure to check out the options and see which one fits you and any leadership team members you may want to bring along.
If you register before the end of the year, you'll get the early bird rate plus some new VIP perks.
All the details are at wellnesscentercreators.com/retreats, and we can't wait to see you there.
Today's episode is sponsored by Jane, a clinic management software and EMR. Waiting on hold isn't anyone's idea of time well spent, especially when you're busy providing exceptional care to your patients and clients and running your clinic. The Jane team knows how valuable your time is. That's why they work hard to keep call wait times to an average of 2 minutes. This means you can get quick answers to your clinic questions and head into your weekend with one less task on your to-do list. Plus, unlimited phone, email, and live chat support from their team of friendly humans is included in every Jane subscription. So, no matter where you're at on your Jane journey, they're always there to lend a hand. To see how Jane can help you take back your personal time, head to jane.app to book a one-on-one demo, or use the code wellness1mo at sign-up for a 1-month grace period applied to your new account. Hi there, and welcome to the Wellness Center Creators Podcast. I'm Kendall Hagenson.
And I'm Anna Rudell. We're thrilled to have you join us on this journey of creating innovative, patient-centered wellness centers.
As experienced health and wellness providers, we've seen firsthand the challenges of delivering comprehensive, holistic care to our patients.
That's why we created this podcast, to share the knowledge, strategies, and insights we've gained from our own experiences and from connecting with experts in the field.
Each episode, we'll dive into a different aspect of building and growing a successful wellness center, from developing a strong multidisciplinary team to implementing cutting-edge technologies and treatment approaches.
We'll also share practical tips, resources, and real-world examples to help you overcome common obstacles and streamline your processes.
Our goal is to empower you with the tools and confidence you need to create a thriving wellness center that truly makes a difference in your patients' lives.
So whether you're just starting out or looking to take your existing practice to the next level, you're in the right place.
Get ready to learn, grow, and be inspired. Let's create something amazing together.
Welcome to the Wellness Center Creators Podcast.
Welcome back, everyone, to the Wellness Center Creators Podcast. Today on the show, Anna and I are going to talk about this idea of informed consent in the wellness industry as a whole. Hi, Anna.
Hi, Kendall.
Hi. Sounds like you had a little bit of a rough weekend.
Yeah, generally speaking, it's been an interesting summer, and it's only been punctuated by this past weekend where my son was admitted to the emergency room to have an appendectomy for a ruptured appendix, because we can't be happy with just having a normal appendix removed. So, yeah, it's been a journey, and but all went smoothly. He's in hospital drinking, of all things, this I swear, this is his first meal, strawberry Nesquik.
Oh dear,
the pain. I have to sit there and smile. Yes, whatever you want, darling.
Yes,
strawberry Nesquik.
He's pretty resilient.
Part of me thinks, he hasn't eaten in 4 days, so he could use the calories, but not ideal.
Yeah.
As I saw that vile sort of pink fluid coming out of the straw, and thinking to myself, this is not what I would normally feel to feed an ailing 14-year-old. But hey,
yeah. Well, and it sounds like, you were able to get him the care he needed quickly, because for those who don't know, you're an acupuncturist and doctor of Chinese medicine. And so you were able to kind of diagnose him quickly and get him in.
I was, and I'm really, really grateful for that, because it looked like stomach flu. And I kept telling him just to go to bed and sleep, and that it's probably likely that he hasn't been eating well over the summer and that he's just got a bad tummy. And then after he was not getting any better and the fever was getting worse, and I thought, right, we'll have a good old feel of his tummy. And lo and behold, the right lower quadrant there was screaming when Mum pressed it. So
Mm.
put him into the car straight off to the ER, and lo and behold, it was in fact appendicitis. So he was admitted immediately, and then I'm really grateful for that, because by the time the real pain hit at 5 the next morning, when it became excruciating for the little boy, he was already hooked up to the antibiotics. He was already hooked up to the IV, so they could push some morphine, which I think, in retrospect, he was probably going into that surgery in the best way possible, and that we weren't, dealing with a child trying to get him to the ER, not knowing what was going on and trying to get
Yeah.
admitted in the wee hours of the morning. So really, really grateful for that. But it did bring up a few things,
Yeah.
namely informed consent. I was just really impressed by how many times members of the medical staff at the hospital sat down with him, and then us as parents looked us in the eyes and said, once again, he's being admitted for
Mm-hmm.
appendicitis. He has we didn't know at that point that it was ruptured, but he's being admitted for appendicitis. He has a fever. We are putting him in this room. Later on, we're going to move him to that ward.
Mm-hmm.
And it was really good to be told what was happening. It was good that there were multiple touch points, and it was good that before any and every procedure, there was an informed consent that happened. And I know that in our clinic, that's something we've really struggled with,
Yeah.
because as acupuncturists, if we have to sit down and tell a patient that the potential complication of having acupuncture might be a pneumothorax, I mean, the chance is so minuscule that most practitioners don't even ask the patient or give them the information and then ask for their consent to treat.
Mm-hmm.
And I think what most came out of this last weekend for me was how good it felt to have that communication, and how good it felt to give consent.
Yeah. I'm so glad you had that experience. And I think emergency medicine, this is something that emergency medicine in the US does better than
Mhm.
outpatient medicine in the US,
Yeah,
because there are so many moving parts. Like, they can't not follow these procedures, right?
yeah.
So I think that they really do that better in a lot of ways than even outpatient primary care in particular, or specialists who are not in the hospital. And then certainly in alternative medicine and wellness, I think
Mhm.
the level of detail of the protocol and kind of just like really committing to that process clinically, I think it takes more efforting in our types of environments, because we have, especially when we're bringing like multidisciplinary backgrounds or alternative healthcare providers, who everyone is trained a little bit differently when it comes
Mhm.
to informed consent and even HIPAA, and even, that, whereas a nurse and a doctor who are working in the emergency room, like, they're following a really strict procedure.
Yeah, and it didn't feel threatening. I didn't feel afraid. I felt safe and I felt seen.
Good.
And I think those are huge takeaways.
hmm Do you feel like you've had feedback on your team where people are nervous to give the informed consent as acupuncturists because they think it will create fear for the patient?
Absolutely. That's been, I'd say, one of our biggest struggles of this year, 2025, has been the implementation of informed consent in the treatment room. As acupuncturists, I don't believe we're trained in informed consent. And when we called one of the insurance companies and asked them for their recommendations around this. They told us that we were one of the only clinics doing it. And a little round of applause there for us. But, so
Which
we
is
were trying.
also terrifying.
Terrifying.
Yeah.
Yes. And so in our clinic, we got a lot of feedback around it. People were very unhappy. And it took us a while to create a script that felt manageable on the part of the practitioner to deliver to the patient. And they were terrified that the patients would get up and walk out of the treatment room the minute that they said that there might be a side effect of needling or cupping or gua sha. We've gotten there, but it's taken us the better part of a year.
Yeah. I think in school for psychotherapy, informed consent is at the forefront of what we're doing. And so that was one thing that I had to really learn when I opened the multidisciplinary practice, was that aside from our physician team and the psychotherapy team, most of the other modalities were not trained to this level on informed consent. And
Mm.
so it became, well, we need to build a system around that, and we need to, have our set standard of how we're going to do that, and to be able to teach in a way that providers understand the importance of it, because it starts to feel unnatural, right? If that's not how they're trained in their schooling. Like for us as therapists, it's the first thing we do, even meeting clients on the first day. We're building trust, we're building rapport, but part of that trust building is being so upfront and direct with the client of, these are the risks and benefits of therapy. Here's what to
Mhm.
expect. Do you consent to moving forward? Asking permission all the time, like even with interventions, and we're not needling people, but I'd be across the couch saying, if I have your permission, I'd love to try something with you.
Right.
Right. And
Right.
here's what I'm thinking. Would you like to do that? Um, I think massage therapists, oftentimes have that lens because they're touching, the whole session is touching another body, right? So I think that can be at the forefront. And then acupuncture is that middle ground where it's medicine and you're also touching people's bodies.
Right. And you're using needles.
You're using needles, you're using different tools. It's
Yeah.
actually wild to me that it's not more, at the forefront of the curriculum.
Forefront, anywhere in the curriculum, maybe it's changed,
Mhm.
and that's the other thing. Maybe it's
Right.
changed in the 25 years since I was in school. Hopefully it's changed, but I don't get the sense it has from my experience as an employer and
Sure.
bringing newer graduates on. And of course, the other thing that goes along with that is documentation,
Mm.
making making sure that it says somewhere in the patient chart that the conversation's been had and the patient consents to treatment. And it's not
Yeah.
just sort of this. I think, there is, as I think about it, there is an informed consent that used to go out on the back of an arbitration agreement.
Mhm.
So the patient would sign an arbitration agreement and an informed consent. But that doesn't hold up if the patient doesn't have time to read it,
Mhm.
or it's not specific. You're not having that conversation with the patient.
Yeah, I think like with the introduction of web-based EHRs and softwares, informed consent is included in intake forms and the intake process. And we all know that people are not reading them,
Mm-hmm.
right?
Mm-hmm.
So then that's where you came in with your team and said, yes, people are giving consent on their intake form or when their initial forms, but we also need to say this out loud to them and get their permission to continue.
Yeah. Yeah. And as employers, it comes down to us as well, doesn't it? To, as you just said, learn how to teach your employees
Yeah.
how to do it.
Yeah. And I think for strategies around that, for us, what has worked the best is just giving real life examples
Mm-hmm.
from practice of like, here's a time when, a clinician on the team, got permission for this, but did not give informed consent for this. And then X, Y, and Z happened. And now we have the consequence over here.
Right.
And right, like that's just the most effective way rather than saying it's important because it's important. And I promise you, they will have more trust with you if you do it. Right. It's
Right.
like hearing your mom tell you, like, I promise if you just are safer, you'll, you'll, thank me later. It's like, no, they need to have a real life tangible example of like actually what's at stake for them as a clinician and their license and their, retention of patients if they don't go through these motions every time.
Right. Right. Yeah. And then, then there have to be all the additional steps there. So you've got your documentation, which in our case is, I think we have a / paragraph that we put in,
Mhm.
or maybe it's even we've got a script written in there and then the practitioner can just check that box off
Great.
as done. But then you have to have your chart audits, don't you? It's a domino effect because
Mhm.
you have to make sure that that's being done. It's in every patient chart, and then there have to be consequences if it's not done.
Yeah. Yeah. From an employer standpoint, right?
Yeah.
Or
Yeah.
whoever's your medical director on your team or whoever's, in charge of that, of the liability piece, we can put these protocols in place. And oftentimes, what Anna and I see with our coaching clients who are, running a practice is at some point we all have a moment where we think, everyone on this team is a professional and clinically trained or, whatever experience in whatever they're doing. They should know, they should just be doing this as best practice. Not necessarily, it doesn't need to be a system, a protocol on our team. It should just be best practice wherever they are. But the reality is that that's not universal across the board. So we do have to audit charts.
Yeah. And that not only is that the reality, it's also a reality that the people that are usually most responsible are the people that do it less.
Why?
I don't know. It goes with, don't you find the
I'm trying to
lead
think.
people and
Well,
people that have the
sometimes.
most charts maybe do the do the least charting? I don't know. It's sort of
I think that sometimes that's true.
universal
I think
law.
it might be that they have like so much on their plate that they kind of forget like the daily tasks of it. But I think on our team, it has been the leads actually have done a really great job with the charting. And mostly because we've tasked them with auditing their team members' charts that they are leading. And if they have to tell their team member to do it differently, then they got to walk the walk themselves.
Well, exactly. That is definitely a learning. But I will take myself as a terrible example of
Oh, for sure.
historically being a bad charter.
Yeah, I never minded doing charts. I don't do, see therapy clients anymore, but I also wasn't, it wasn't my favorite part necessarily.
No.
But yeah, I know it can be really a sticking point for clinicians to do a chart at all, But I think being so clear about what we expect, as we're teaching new clinicians, and I think we see this a lot like on our mental health team as we have interns coming in and new clinicians that our lead therapist has many opportunities to say, great work, and make sure to put that in the chart.
Right. The
Like
informed consent is important.
everything needs to go in there. And so.
Yeah. Yeah. Well, that was my takeaway,
Well,
Kendall.
yeah, I think it's a good topic and we hope it's helpful to our listeners. I hope your son is, in a speedy recovery and I'm glad you all had a good experience.
Well, thank you. Thank you. Yeah, I'm back off to the hospital right now.
Nice to see you.
You too, Kendall. Thank you for tuning in to the Wellness Centre Creators podcast. We hope you found this episode informative and valuable.
If you enjoyed the show, please consider subscribing and leaving a rating and review. Your support helps us reach more health and wellness professionals like you.
For additional resources, show notes, and more episodes, visit our website at wellnesscentrecreators.com.
We'd love to connect with you and hear your thoughts, experiences, and questions. Feel free to reach out to us through our website or social media channels.
Once again, thank you for listening. We appreciate your dedication to providing exceptional patient care.
Join us next time as we continue exploring the world of wellness center creation. Until then, take care and keep making a difference.
Thanks for listening to the Wellness Center Creators Podcast.